Hello, you're welcome. My name is Tom Rogers Muyunga Mkasa. For this week 8 discussion, I chose choice number 2, the one that asks us to provide verbal presentation. So, before much ado, my verbal presentation is around the pandemic, rather the period before the pandemic, during the pandemic, and after the pandemic. It establishes the relationship between the pandemic itself, special needs issues, and education outcomes. In Washington, D.C., public and charter schools among 6 to 8 graders. All right. There will be an introduction, there will be methodology, there will be findings, and within the findings, I'm going to expand on what I'll be talking about in a more depth way, and in an in-depth way. And eventually, there will be a conclusion plus a recommendation. All right. Let's get it on. This is a verbal presentation of statistical findings in a study to establish the relationship between special needs, education outcomes, before the pandemic, during the pandemic, and after the pandemic, particularly for the years 2013 to 2024, in Washington, D.C. public and charter schools among 6 to 8 graders. The student population of Washington, D.C. is approximately 98,663 students across all public and charter schools. Of these, 14,799 are special needs students. This study was conducted to establish the relationship between the pre-pandemic, the pandemic period and post-pandemic period, emotional disorders, mental health, and special needs students' educational outcomes. Now, in order to establish this relationship, the investigation followed studies done between 2013 to 2024. The studies that were able to investigate established trends in demand and uptake of interventions by grade 6 to 8 special needs students in Washington, D.C. public and charter schools. The sources used to come up with an outcome report included articles which employed observational studies of grade 6 to 8 special needs students in Washington, D.C. public and chartered schools. Special needs are linked to mental health, which in turn has a significant impact on an individual's education. Depression, anxiety, stress lead to difficulty in concentrating, focusing, and retaining information, as well as engagement in school activities. This in turn decreases academic performance, leads to absenteeism, and a lack of motivation. There are other difficulties, such as low or lack of concentration, engagement in class, poor learning retention, social interaction, and overall academic performance, which reduces, leading to challenges with adapting to a classroom environment. In some cases, emotional needs go untreated, which can prolong negative issues, hindering their ability to reach the full potential in school, in social interactions, and in communities and families. These issues that are barriers to learning were adopted in what is known as the Individual Education Plan, which is a legal and policy document, which in turn is linked to the Constitution, as well as the Bill of Rights and all these other non-discrimination, equity promoting, as well as non-stigmatizing and desegregation laws that were put in place. Now, the IEP is a legal document which is used to address any eligible special needs student needs. The schools follow a grade band associated with the Office of the State Superintendent of Education, known as the Uniform Per Student Funding Formula. So these schools that admit special needs students cannot admit them unless they've taken them through an assessment. And this assessment has to follow certain criteria, so that then once the student meets this criteria, they are then linked to funding. But this has to be under what is known as the Uniform Per Student Funding Formula. That is the eligibility criteria. Now, in the case of Washington, D.C., the first criteria is to categorize the students in class form. So we have what is known as the pre-kindergarten and elementary school students. They have their particular eligibility criteria. We have what are known as the middle school students, 6 to 8 graders. We have what are known as the high schoolers, which is 9 to 12, as well as the adult or alternative special education students. But for my study, I chose to concentrate on 6 to 8 graders. Now, what is the methodology that I used? I used quantitative and qualitative methods. I used a list of sources using primary data, including anecdotal interviews and peer-reviewed secondary data. I used titles and keywords to come up with articles of between 70 to 75, but I reduced them down to all the way to 35. I also used textbooks because in one of the anecdotal interviews that I had, I asked for which kind of books, textbooks that are talking about mental health, emotional disorders, and school performance. Anyway, a literature review generated subject matter expertise of investigators who are in this area, who are authorities. Study designs chosen were linked to preferred outcomes, sample size, methodology, validity, credibility, and applicability of results. The studies made the connection between demand and uptake of special needs interventions during the pre-pandemic, during the pandemic, and post-pandemic periods, ensuring equity, low cost, and quality services were used, were known, and were available. The reports were analyzed for evidence supporting claims of trends, causality, cause and effect, and variables. Now, when reporting statistical findings, I also noted that ethical considerations, including data confidentiality, obtaining or informed consent from participants, avoiding misleading interpretations, clearly disclosing limitations of the studies that were made, as well as my own study, managing conflicts of interests, and presenting results accurately and transparently, all the while minimizing potential harm to individuals or groups presented by the data, was adhered to. Even in my case, I even when I was doing anecdotal interviews, I made sure that I don't mention names or even sources. Now, what were the findings? These findings that I came across from the different articles, as well as the anecdotal interview analysis, plus the instruction that were given, this is what I came up with, especially using the statistical language. A bivariate regression was conducted to examine the possibility to predict level of needs across the years. A scatter plot showed that the interrelationship between time and level of needs was positive, linear, and did not reveal any bivariate outliers. There is a correlation between time in form of years and level of needs, which is statistically significant. The regression equation for the prediction of level of needs from years is y equals negative 2355618, and there was a lower there was a lower, excuse me, the equation is y equals negative 2335,618 minus 118.375x. Now this is what I can use to predict. You would excuse me, this is the full equation. Sorry about that. But anyway, there was a lower demand for uptake of intervention in pre-pandemic, followed by the pandemic, and more in the post-pandemic period. Using SPSS, it was established that the range of level of needs are from 1,143 units experienced in pre-pandemic period to 7,202 in the post-pandemic period, meaning that there were more demands and uptake of services for interventions post-pandemic period than the pre-pandemic period. The standard deviation is 1,492 with an R of positive 2.54 and R squared, capital R squared, is 0.64. This means that 6.4% of the variance in level of needs is predicted across the years 2013 to 2024. Using simple linear regression, a linearly similar data along a regression line was plotted. There were no outliers, and the residual minimum and maximum values for the standardized residuals did not exceed negative 3.29 or positive 3.29. The independence of observations was calculated using the model summary, and the outcome was 1.988, which showed closeness to 2. So that independence of observation was also met. The PP plot showed dots that generally lie along the line. Across the years, the level of needs increased by 0.254. More students are demanding for interventions during the post-pandemic period than during the pandemic or pre-pandemic periods. There's an explanation. Maybe it could be as a result of social distancing, as a result of, isolation and all that. But after the post-pandemic period, more demand for these services increased. The emotional health issues faced by individuals with special needs includes anxiety, depression, aggression, self-harm, obsessive-compulsive disorder, bipolar disorder, attention deficit hyperactivity disorder, ADHD, post-traumatic stress disorder, PTSD, and difficult managing frustration due to communication challenges, often stemming from one's lived experience of a disability. Now, this study, like I said before, looked for preferred measures, and it used study designs that, like cohort study designs, which establish causality and incident. And the articles that I looked for most specifically showed cohort study designs as well as causality and incident. And then there were also other studies articles that I chose in the that had cross-sectional design to establish prevalence. So the literature chosen used evidence-based approaches to characterize measures in the form of population studied, intervention and outcome, size of population under study, time or occurrence, and established rate, proportion, and ratio. There are the incidence variables that I came across include the pandemic itself, post-pandemic and pre-pandemic period, in other words, the period or the years, emotional disorders and classroom-related behaviors impacting education outcomes. The prevalence variables included the IEP interventions, what are known as level of needs or tiers. We shall come across that as we go on. To ensure educational achievements, the incidence of needs across years, prevalence of needs as well. it was possible to come up with the distribution patterns, determinants, frequency of special needs, and interventions. 2,279 schools were sampled. The other variables captured include the school year, which is 2013 to 2024, school codes, school name, school sector, count of at-risk students, count of at-risk population, share of at-risk students. The sources are valid enough and they name the schools but not the individual students under study. This ensures privacy and confidentiality around identity and disorder diagnosis. This also means that the forms of emotional disorders are listed under what are categorized as SPED level of needs. A student's special education level is determined by the number of hours per week of specialized instruction and related services and any dedicated aid hours received as indicated in the most recent or current IEPs or even an IEP that expired. Special education levels that we analyzed are level 1, a student who requires specialized care within or under 8 hours or less. That is the tier 1 level. Then level 2 is a student who needs more than 8 hours to 16 hours of intervention. Level 3, 16 hours to 24 hours of intervention. Level 4, this is when there are more than 24 hours needed for intervention per student. Now, we are working with students, 6th, 8th graders, special needs students who have needs, but we've also analyzed the needs across time from 2013, that is the pre-pandemic period, to the pandemic period and beyond. So, the report provides the character of variables and interventions analyzed. It explores the standards and ethical considerations used to report statistical findings, the methods used to ensure confidentiality, and they also show attention to ethical processes for linkage to interventions specific for special needs students. There were recommendations that were posited, which I also adapted, as well as being that I've also worked as an IA and substitute teacher in special education schools. I feel that these are the key recommendations that I can share with you. Emotional health related interventions provided at classroom level are prescribed in a timely manner, thereby countering escalation which would otherwise lead to adversities and emotional stress. I can't stress it enough. Teachers need to be trained in identifying stressors and being able to link students to care immediately within the school system. And this is the reason why I did my research in the school system as a continuum for health. Schools invest in creating a safe and supporting environment, providing support, setting up social emotional sessions, teaching emotion recognition and expression, providing individualized support plans, incorporating sensory tools, fostering social skills development, offering parent education and therapy, and ensuring collaborative efforts between students, educators, therapists, and families. This will ensure better education, behavior, and social outcomes. For me, public health and using especially statistical approaches has enabled me to 1, identify needs, 2, link the needs to interventions, 3, being able to come up with a report that I can use to come up with, policy reports, inform planning, inform programming, and policy. I'm so glad that I've been able to come to walk my journey and come to this point. Thank you and bye. Remember, my topic has been around the pandemic period, special needs children, and how these relate with each other to affect or influence education outcomes. Bye-bye. Thank you.